I said, I'm a fighter. I choose to live. I'd rather die fighting than just give up. Hi, I'm Kathy Yarbrough, and I am a survivor of squamous cell carcinoma of the anal canal. On the 25th of March 2019, I went in for my colonoscopy. Wednesday morning, I'm driving to Salt Lake, and he calls me, and he told me that the pathology report had come back and that it was squamous cell carcinoma of the anal canal, which of course it went right over my head. I had never heard it. It took me probably a year to be able to even say it, and I honestly believe that without the doctors that I had treating my cancer, from Gila at the women's clinic to Stacy to Dr. Vandersteen, I would not be here today had they not all played their part. They put together such a great team. There was 3 directions we could go, where we did nothing at all. I was 56 years old, and I would live maybe 3 more years, and 2 of it would not be worth living. Or the second choice would be to have another surgery, probably have a colostomy, and have a 60% chance that it would cure it, a 40% chance that it would come back, and if it came back, it would be untreatable. Or there was the third option, which was a 95% or 90-some% chance to cure it, but the chemo and the radiation would be so aggressive that would be more likely to take my life than the cancer. All 3 of the doctors felt very confident that I was strong enough to withstand that much chemo and radiation, and that they would take me to death's door, but they felt that I was strong enough and young enough and healthy enough that they could bring me back. So I said, I'm a fighter. I choose to live. I'd rather die fighting than just give up. So I went with that option, and the chemo and radiation was horrific. And I fought for a year. I don't think I left my house for a year. I don't think I left my bedroom for probably 3 months. Didn't see my grandchildren. Both of my boys were sure that I would not survive, just because it was so, I got so weak and so, just so sick from the treatment. But then things started coming back. There are no signs or symptoms to anal cancer, and usually it is not found or diagnosed until it's way too late, and that's one of the reasons that it's just not a curable cancer. Going into the colonoscopy with a good GI doctor is important, because I did not have a colorectal cancer. I had a skin cancer, but because Dr. Vandersteen knew what he was doing and what he was looking for, he recognized it right off. And I don't know that a general surgeon would have realized that that freckle was skin cancer, an internal skin cancer. I get to live, I get to spend time with my family, I get to see my grandchildren. I just get to enjoy life, and it really, really, truly does keep getting better. I'm 6 years past cancer, so I'm 1 year considered cured, and I couldn't be happier with my life. I'm grateful for every day that I have.